Hi, everybody, it is Mike, 55 years young, and I am here with my dentist, Dr. Ali. And I've said in my book, Live to 150, which you can get for free at liveto150.org, that your dental health is a very accurate reflection of your overall health and well-being. So you have to focus on this if you want health span and longevity, if you want to make sure you don't have any non-communicable disease. And everyone does this bruxism, although you may never have heard of bruxism. It's basically like grinding your teeth. And I'll let Dr. Ali take it from here.
Hi, my name is Dr. Ali Miamee from RTC Dental in Reston, Virginia, and I'm here today to make a short video about bruxism, which is also known as that tooth grinding habit that all people do. All people do this both at nighttime and during the day while we're awake, and it comes from stress. So it's going to be physical stress, emotional stress, psychological stress.
Okay, all people do this. This is an important takeaway. Don't think it's not you. I can look at my teeth. I can see I got more teeth on this side, less on this. That means not only am I not eating evenly, which is only a small part of this bruxism, but I am grinding my teeth. When I clench them together, it's wearing this side. So I need to learn to not do that. I remember back in the day, I used to say, hey, I always wear my retainer at night. And they were like, well, you need a night guard. This was a few years ago, and I didn't understand any of this, but listen to what he says, and you will start to understand.
All kinds of stress cause this. Every single person does this, both at nighttime and during the day. So we're going to give you some tips today about how to control this and avoid it and avoid some of the damage to our teeth. Now, when I explain to the patient in the dental office about bruxism, and I try to explain to them that they have this habit and they're damaging their teeth, many times the patient is not aware of this. In fact, a lot of the times the patient is skeptical. So usually we'll bring a mirror over and kind of show them the flat spots on their teeth. There's several areas of damage that we can show with regards to wear facets, abfractions, craze lines, cracked teeth, and many different features that we can show the patient. So like
I will also add that just unexplained pain. Sometimes I've even gone in more recently and I said, hey, doc, my tooth is hurting. Is it cracked? Is it need a crown? And they can't find anything. And just that clenching down creates pain. You may have experienced this. If you have, let me know in the comments.
I said, it's a bit of an ordeal sometimes because we use the mirror and we show them all this stuff to kind of convince them that the damage on their teeth is coming from this tooth grinding habit that they're completely unaware of up until now. A lot of the times the patient will tell me, no, I was eating some breakfast a couple years ago when this little chip happened, or I was doing some sports activities when I got bumped.
Don't worry, doc.
So we understand that some of those areas might have been from sports.
Some. But almost always it's bruxism, like he says. Remember that term, bruxism.
And situations like that. However, then we show them that it's very obvious to the dentist on the back molars and many other areas that all these wear facets that are configuring to one another very intimately, it's very obvious that this is from bruxism. There's no question about it. And we try to show the patient and convince them of that. So most patients, of course, once we show them that, it becomes very obvious to them also.
Let me tell you, for me, it took a little convincing, but I got my night guard a few years ago anyway. And I would say it's definitely helped me. And I've learned even more recently that it's the nights I don't wear it when I have problems like he's going to describe here.
And then most people are ready to go ahead forward with those recommendations that the dentist makes for this with regards to a night guard and some other things that we will explain right now. So with regards to some of the preventative measures that you can take to avoid the damage from bruxism with regards to your teeth, the most important tip that we can give you is, of course, just wearing a professionally made hard night guard every single night when you go to sleep.
Not soft.
Because the majority of this damage happens at nighttime when you're asleep. The more intense.
Yeah, and he's saying professionally made, not one of those soft ones you sink your teeth into, not those.
Grinding happens at nighttime when you're asleep. Of course, grinding or clenching still happens during the day, every single day while you're awake, all throughout the day.
And you have to find out the certain situations because we've all learned them, not on purpose, but accidentally. And we do this. I still have to think about what I'm doing during the day so that I don't clench my teeth.
But I do believe the more intense grinding happens at nighttime when you're asleep. So it's what we call lateral excursion motions and a little bit of an anterior or forward excursion that the patient does when they're sleeping. Now this is only about 2 to 3 seconds out of every hour. It's not like you're clenching and
That's a
grinding all
lot.
night during your sleep. This is during the deep sleep stage known as REM sleep, which is random eye movement, which is also the time that you're experiencing your dream. So your dream might feel like a 10
Yeah, there's no controlling that. That's kind of what he's getting at. You're going to do this. The only question is, what are you going to do about it so that it doesn't affect you negatively?
minute dream, but it's actually only a few seconds, the way that it plays out in your brain. And it's during that time that you're doing your clenching and your excursions and your grinding, and you can cause some pretty significant damage to the teeth, to the enamel. Also, the ligaments around the teeth can become very tender and sensitive. Even it can create cold sensitivity inside the teeth, thermal sensitivity that comes directly from this grinding situation. Many different things can happen, and it's all coming from the grinding that's happening at nighttime. So the main tip about that, obviously, is just have a professionally made hard night guard that you're going to wear every single night. And I tell all my patients, 5 nights out of the week is not really enough. You'll still get some symptoms. You'll still get some chips and some cracks.
Every night.
It's really important to wear it every single night, 7 nights out of the week with great discipline.
Yeah, with great discipline, and you will see the difference. You will feel the difference just skipping a night. And if you don't wear one of these at all, you'll probably be amazed at how your life improves after getting one and wearing it.
And also, I tell the patients that, it takes a while to start to see those benefits. So this is maybe many years that you've been grinding and creating some of that tenderness in the ligaments. So when you get your night guard, you really have to stay the course and wear it with great discipline for months. Sometimes even for some of my patients, it took almost a year to get all the great benefits. But basically 100% of the patients who follow this protocol get great benefits and come back to us eventually telling us that, basically everything is all resolved or 90% resolved for our most severe grinders. Now, so at nighttime, we've already made our little recommendation of having a professional made hard night guard to wear every single night. During the day, we also do grinding and bruxism during the day, every single day, all throughout the day. Most patients are completely unaware of this. In fact, when I was first taught about this in dental school, it didn't make any sense to me either. I didn't believe the guy who was...
Listen to Dr. Ali. Listen to what he says about this. You can pick up some very beneficial tips for your health.
Lecturing. So it took me a few months before I realized what he was saying was true. And basically what he says is that during the day, stress will cause you to grind and clench during the day also. Physical stress, emotional stress, psychological stress, they all cause it. So
I find even if I'm kind of getting some strength to do something difficult, that's a trigger for me. I'll kind of clench, even if I'm lifting weights or doing something outside, lifting something heavy, the trigger could be different for you. Let me know in the comments what your triggers are that cause you during the day once you start to become conscious of this as to what's causing the bruxism for you.
What he told us we're supposed to do is basically monitor for inappropriate, undesirable contacts throughout the day and try to control that consciously. It's a protocol that he called conscious intervention. And so now I'm going to discuss that a little bit with you, if that's okay.
It's the way to go.
So the way that works is that he explained, during the day while you're awake, the resting position of your jaws is such that you have 2 to 3 millimeters open space in between your upper teeth and your lower teeth, and this is true. The upper teeth and the lower teeth should never touch one another during the day while you're awake, except for 2 situations that we consider it to be acceptable. When you're chewing your food in a very gentle, controlled manner, the teeth can come together and touch, which is fine. Also, when you swallow saliva, I'm going to demonstrate. Like that. So basically your tongue comes up to seal the throat and it lifts the floor of the mouth up. There's a small touch of the teeth and this happens when you're swallowing saliva. So this totally fine and acceptable. However, any other contact whatsoever from the upper teeth to the lower teeth during the day while you are awake is completely unacceptable. And I know this sounds like an exaggeration. I did not believe it myself when I heard it. But what I want you to do is just take my word for it. Assume that it's true, monitor yourself, observe yourself, and try to see if what I'm saying is true over the next few months. It took me 3 months before I had my epiphany. I was just at home studying during dental school, and
That's what I'm saying. Even I didn't believe it at first, and it's taking me a lot of time till I'm making the connection, but this is a thing, and it follows along with what I say in my book, Live to 150, totally free at liveto150.org. Listen to it like a podcast or an audiobook. It's all about habits, and unfortunately, almost all of us were trained wrong. I was never trained about this. I'm not blaming anyone. I'm just saying you have to have an open mind, and you can do so much better with your health, and this is just one aspect of that.
I realized just studying in my apartment where I was very relaxed, TV's on in the background, I'm studying, this is the environment that I like to have. But I noticed that I was definitely clenching my teeth. So then I started to employ some of the tips that this particular dentist gave us during the lecture, and I realized on that day that everything he said was true. So some of the things that he said was, for example, that anytime you notice any contact from the upper teeth to the lower teeth at
any contact at all, okay, underline that.
all during the day while you're awake. If it does not fall into those two categories that we already mentioned, which are acceptable, then you must immediately recognize this as part of that bad habit called Bruxism.
Yep.
You must acknowledge it as part of that bad habit. You must consciously open yourself, just consciously open. And then the fourth thing is you can go ahead and log in your mind what you were doing at that time to cause your stress, because you're going to see that there's basically a handful of items that are common stressors for you that are causing the majority of this
Everyone's
for you
different,
in
that's
your
for
life.
sure.
However, I want to expand on that, and I like to tell everyone that even the silliest little things will make you grind your teeth together and clench. So, for example, opening a pickle bottle, and it's a little bit tight, a little bit difficult.
It's
I can almost assure you,
exertion
if you're
of
paying
some
attention,
strength.
you will notice your teeth are touching a little bit
That's
because
for
you're
me.
concentrating on this motion, and it's a little bit of physical stress, physical strain on your body.
Definitely.
Maybe even a little bit emotional or psychological stress, and this is going to cause some clenching. Also, another silly, goofy little example is if I'm in the kitchen cooking and I forgot one of the pots for the potatoes and I'm reaching far, trying to contort myself to get over there, again, you'll notice some small touching of your teeth. So even the smallest, silliest, goofiest things will cause it all day long, and it's your job to kind of start to pick up on these things. So you have to train yourself to
become conscious, become aware. That's so much of health.
Be able to pick up on these things. So the things that he told us to do during the day is basically monitor for these inappropriate contacts. Anytime you notice any contact from the top to the bottom whatsoever, you will immediately open yourself, consciously open, and log in your mind what you were doing. Now, the interesting thing is,
or you can log on a note on your phone. Document it somehow so you don't forget.
It's going to be that a couple minutes later, you're going to notice you're doing it again.
Yep.
So then you're going to consciously open yourself. A couple minutes later, you're going to notice you're doing it again. And then you're going to realize that this conscious intervention is not quite enough. Very useful, very helpful, very true. You're going to realize that what we're saying is amazingly true and important to protect your teeth. However, you're going to notice the conscious intervention is not quite enough, and so some of the other tips that that particular dentist lectured to us about is, for example, using a temporary night guard during the day. When you notice yourself habitually going back to clenching and you've already tried to utilize conscious intervention and it's not sufficient,
you realize it doesn't work. Don't quit. Don't quit. Keep going.
You can use a temporary night guard, which, for example, could be your tongue. So one tip is to push your tongue to the roof of your mouth, and that does force you to open your teeth up just by random coincidence. So you can push your tongue to the roof of your mouth, and that will help. And during the day when you find yourself doing this frequently. Final things that I like to mention in this little speech that I give to all my patients is that you should catch yourself inappropriately clenching and grinding your teeth together during the day while you're awake almost 100 or 200 times each and every single day.
It's a lot.
So it's very frequent, and it's very important for me to push that onto the patient and help them to recognize that. And
think of the wear. If you could pull the tires on your car off the road from touching hundreds of times a day, they would last so much longer. That's kind of what this is.
Catch that when they're at home, that this clenching and grinding is happening 100 or 200 times each and every single day inappropriately.
Yeah.
So over time, though, after many months, you will start to learn not only to recognize it, but to intervene consciously.
You will learn if you have an open mind. As I've said before, so much of this health is about learning, having an open mind. That's the only requirement. So I hope that you are taking this seriously, and please pass this video along to anybody else who has teeth that aren't all implants. Even if they are implants, you can still make them last longer by following this advice.
You will not only start to open your teeth up every time when you notice it's happening, but also you will start to notice that the intensity of the clenching and the grinding has reduced significantly based on this new intervention that you're practicing each and every single day. It will basically become a habit. It will become second nature. You will retrain these muscles, and the clenching will become less and less significant over time. So the last thing that I like to mention about that, however, is that I like to joke with people and tell them that I consider myself the guru of conscious intervention. So what do I mean by that? Basically, for 12 years now, ever since I learned this back in dental school, I've been practicing this very carefully, very diligently. I think it's very, important and effective, and so I believe in it very much.
And by the way, he just learned this. Well, he's older now by a few more years, but it's best to teach your kids this. Talk to your kids about this, okay? Play this video for your kids. Better to learn early, like most habits.
Been practicing it very carefully for 12 years. So I like to tell my patients, I consider myself the guru of this. I don't think anyone can do it much better than me. However, what do I mean by that? I like to elaborate and explain that I still catch myself clenching and grinding my teeth together during the day while I'm awake 100 times or 200 times throughout the day, each and every single day. So it basically never really goes away. However, I still think that I'm doing a really good job for myself. I tell my patients that I'm very confident that this conscious intervention is helping me a lot, even though I still catch myself doing it 100 times per day. So what do I mean by
In other words, you'll never be perfect, just like everything with your health, but you should try to do the best that you can. Enjoy your time while you're here, and this is another strategy for you.
that? Basically, I tell my patients I'm hyper aware of it. I'm all over it. I'm on top of it. As soon as I notice any slight contact, even the tiniest little bits, no matter what I'm doing throughout my day, no matter how complicated the procedure or whatever else I might be doing, like driving in traffic on the streets, I'm constantly hyper aware of it, and I'm constantly intervening very nicely. So even though I notice it happening 100 times throughout the day, the intensity is very low. So in the past, I used to get pain and discomfort in my teeth. I used to get shooting electrical shocks in my canine.
I was feeling some of that. And I went to his office again recently, and I just, I didn't think about it, but I have made the connection again. Sorry, my phone was ringing. That between this bruxism and that, and my pain that I was having, and they said there was no crack, there was no filling needed, there was nothing. This is so important. I cannot understate this. I really wish that people would teach this to their kids right after they're born.
Canines, because I do something with regards to tapping my canines in an alternating manner. So I used to have pain, discomfort, symptoms, all kinds of problems, and all of that is gone. I haven't felt electrical shocks in my canines for as long as I can remember, maybe 8 years. So this is why I know I'm doing a good job for myself. I know that conscious intervention is very helpful and important, even though it's not going to completely.
And with a lot of things with health, you're going to notice the benefits almost immediately, and that's the motivator that keeps you going. You see these improvements. It's just like anything else. It's like learning how to do anything, especially in the beginning. You see giant improvements, and I hope that is your motivation to continue.
Solve the problem. You'll still find yourself clenching 100 times throughout the day, even after 12 years of practicing this protocol, like myself, very seriously. And the only last thing that I like to mention about this is that basically, again, the grinding can cause some damage not only to the teeth, which is very obvious, but also some of the surrounding tissues, like the ligaments around your teeth, the disc in your joint here, and even the muscles. So, and then the very last thing I want to mention is with regards to night guards. So
there we go.
Over-the-counter night guard is made out of soft acrylic, which is exactly the opposite of what we're supposed to recommend. All the literature shows that you're supposed to use a hard, professionally made night guard that's made out of hard acrylic. The ones that you get over the counter are boil and bite, one size fits all, which is also not good. But to make it a boil and bite product, you have to basically use soft acrylic, which is completely inappropriate. The literature shows that it actually exasperates the grinding problem. It trains these muscles to clench more at nighttime, and it actually makes them stronger. So a hard night guard does exactly the opposite. It kind of splints your teeth open to a certain level, and this is actually shown by the research to actually reset the memory of your muscles right
I'm noticing as I swallow here, when I'm talking, in between talking, I am clenching just a little tap of the teeth, like you said earlier in this video.
Here in these masticatory muscles, and so over time it will actually reset the neuromuscular mechanism to stop the grinding, to a significant extent. So, and then we tell people that this is synergistic. If you wear your night guard every night at nighttime, you are resetting the memory of these muscles, and during the day you will definitely do less grinding over time during the day, even without the conscious intervention tips. But then on top of that, you're going to layer in the conscious intervention tips that we're giving you, and all of this stuff together is very synergistic and it works very nicely. So basically, we definitely recommend a professional-made hard night guard for every single patient, 100% of patients. We don't even have to look at your teeth. This is a generic recommendation that we know every single patient.
And I'm here to verify this is not some kind of quackery or effort to drum up business. He's just trying to help people. And this is a seriously large part of some bad things that happen in your teeth that is overlooked by almost all dentists, unfortunately.
Is grinding. Any 13-year-old child, if you put them in the dental chair, I can show you some signs of grinding on their teeth even from that age. But of course, it becomes more important at the age of high school and college, grad school. If you have a bit of a difficult job, these are the times in our lives where we see the majority of this problem, and we really push on to patients to have their professional-made night guard every single night, and also do your conscious intervention during the day, and so on and so forth. So thank you so much for listening to all of these tips about bruxism.
All right, well, that's Dr. Ali, and I will link below to his original video so you can watch it. But please share this video with others. Leave me your comments because his video is actually not on YouTube, so you won't be able to leave comments there. But leave them here, share this with others, give us a thumbs up, subscribe if you don't already, and I will see you in the next video. Bye-bye.